This is an age of disruption, of profound revolutionary change.
What we're really asking ministers is to empower the ambassadors.
The only thing that you really push forth is the truth.
You don't see many women represented when it comes to the decisions as to how to handle the pandemic.
Hello, my name is Carlo Martuscelli, and I'm a health policy reporter for Politico Europe. 2022 is a special year for the pharmaceutical industry. Coming out of a once-in-a-century pandemic, the industry has to grapple with a renewed regulatory push from the EU. Access and affordability are high on the agenda. Meanwhile, supply chain disruptions continue, and every industry has to deal with sky-high energy prices. That's why it's a pleasure to be joined by Heike Prinz today, head of pharma commercial operations, member of the Pharmaceuticals Executive Committee at Bayer. But before we start, a big welcome both to the audience who's with me in the room and for everyone that's joining online. Heike, thanks so much for joining us today. I want to kick things off with a very basic question. What's the mood at Bayer right now? We're in the middle of an energy crisis and confronted by a very bleak economic outlook. But at the same time, the pharmaceutical industry is generally considered pretty recession-proof. People always need their medicines. So how are you approaching this unique moment?
Yeah, first of all, thanks for having me. And I guess this is a very pertinent question that many companies are grappling with. I think at Bayer, just like at other companies, we are confronted with a volatility in the environment we operate in that probably none of us have seen in their careers before. And whether it's energy prices, whether it's supply chain disruptions, I think these are all topics that are very relevant for us. However, I think we also do see that already as part of the pandemic preparedness, we have built up a certain resilience. And that is helping us now as we have to go through this another set of challenges that we have ahead of us.
Great. Again, to continue on this thread of the commercial operations, when it comes to selling on the European market at the moment, what are your biggest pain points? And do you see any opportunity in the upcoming EU pharmaceutical legislation to reduce friction, or is this only going to be adding to your regulatory burden?
Well, looking at Europe and innovation, pharmaceutical innovation in Europe, I believe we are at a potential turning point. And I will say that I believe that the EU pharmaceutical legislation that is being discussed, I think, offers a once-in-a-generation opportunity to really make sure Europe is continuing to be a place where a lot of pharmaceutical innovation takes place. However, if we take the wrong turns, that may also change. And that's why I think looking at some of the things that are being discussed and debated, both on an EU level, but also in some countries on a national level, we do see some warning signals that innovation may not be as supported and incentivized anymore in Europe as it used to be in the past. That is one. And that Europe is at risk of losing competitiveness versus other parts of the world when it comes to fostering innovation in the pharmaceutical and medical sector.
When you say other parts of the world, can you be a little bit more specific? Which geographies are you thinking of as exemplary when it comes to pharmaceutical innovation? And also, what do you see as China's role in this? I know they're pushing a kind of industrial strategy in the field of biotechnology, but at the same time, there's a kind of renewed sense of closure. So, yeah, both. Are there any good examples, and is China one of those?
Yeah, actually, China is one of those. I would say the US is certainly the other one, but let me start with China since you asked about it. If you just look at the number of clinical studies that are ongoing in China, and if you compare this to a couple of years ago, you see a tremendous increase. You also see the Chinese government deregulating or decomplexing some of the regulations that did exist in the Chinese market, also to attract the influx of innovation and clinical studies, to be precise, but also research, I should say. The other part is the United States. And if we look at, the biotech sector, for instance, that exists in the United States, I think it is still unparalleled. And whilst we do see the biotech sector also starting to play a role in Europe, I think it's still, relatively speaking, much more difficult to have a good innovation coming out of biotech, but then also bringing it to market. This is where I think a lot of the European biotechs struggle, and in the end, not many of them actually are successful. We do have some successful examples, of course, also recently in the pandemic, if you think of the vaccines. But we sometimes tend to look at these and to think, well, this is just the tip of a big iceberg. But in fact, there's a lot of biotechs that struggle. So I think it's the US and it's China that come to mind if I look at where the incentive system around innovation and where also conscious political choices are being made to make sure that innovation happens in those geographies and that also respective investments are happening into this.
When it comes to supporting innovation, though, is it just about deregulation? I mean, obviously the industry is in favor of deregulation. Almost all industries are, but in the US, at least, when it comes to microchips, we've seen the Biden administration recently unveil support for semiconductor manufacturing or microchip manufacturing in the country. Can there be a more proactive industrial policy in the field of advanced biotechnology, or is it really just about cutting red tape?
I think it's a mix of both, I would say. I think if you think of the European Union, we have 27 member states. If I think of regulatory processes, there are some that are at the supranational level, but there are still a lot that are on the national level. And that obviously also leads to sometimes long lead times, until, for instance, citizens in certain countries can access actually a product. If you think of access lead times in Germany, you compare them to Romania, just to pick two examples. I think you have around 130 days until a patient can access a potentially life-saving drug in Germany. And then in Romania, I think it takes up to almost 900 days. So these are just some examples. So it's red tape is one of them. But then I think it's also a lot around creating the right incentive system to have innovation in your territory. And I think that's where probably the European Union could do a bit more. And that is also, as I said, what is being consciously decided and done and implemented in both China and the US, just to name some other examples.
I want to go back to something I mentioned at the very start of our discussion, which was supply chain and supply chain disruptions. The European pharmaceutical industry has quite a marked reliance on Asian manufacturers for APIs. Now, that's a little less in the branded pharmaceutical industry than in the generics, but I think it's there in both. Obviously, there's a lot of attention now on the geopolitical aspect of supply chains, and let me be very clear, I'm referring to the Taiwan Straits. Is that an issue that you're monitoring, and how do you think of your dependence on Asian suppliers?
Yeah, I think in your intro you did mention that this is maybe less of an issue for the R&D-based pharmaceutical industry. I dare to say it's much less of an issue. And in fact, FPIA recently did a survey among member companies that are engaged in R&D, and you do see that about 77% of all active pharmaceutical ingredients needed for innovative medicines production actually come from the European Union itself.
But
and then another 12% come from the US.
But is that true of their chemical precursors as well?
Well, I guess it's to a large extent, it's true for the active pharmaceutical ingredients. Yes, there may be some precursors that are also coming from other parts of the world. Again, I'm not saying everything is coming from within Europe, but I think there is probably a different perception in the public domain than what is really happening. And again, I can only speak about the R&D-based industry, but I think to a large degree, there is a lot of pharmaceutical ingredients that are being sourced from within the European Union. Now, that also means we need to keep trade flows open, because that is very, very critical. At the same time, I'm also not suggesting that there's not more we need to do to increase the resilience, because, as I said initially, I think volatility is increasing as we speak, and that is also why companies are continuing to invest in building resilience for their supply chains.
Okay. Heike, thanks so much for that. We're at the end of our interview, but we're going to return to every single point you mentioned later on, both on the question of incentives, just in a couple minutes, and then we'll also have a discussion on supply chain resilience later on today. So everyone stay tuned for that, and thank you once again for joining us, Heike.
Thanks for having me, and have a good conference.
Thank you.